We welcome you back to our program for today. As always on Thursdays, we had a chance to meet one of the fine doctors with Kaiser Permanente here in Orange County. Joining us today is Dr. Aparche Yang, and we welcome you to the show, Doctor. Good to have you with us.
Thank you. Nice to be here.
Dermatology, the largest organ of our body, the one we see every morning usually, is in our skin.
Yep.
And that's your area of specialty. How did you get involved in medicine, first of all, and then in specializing in dermatology?
Well, in medicine, I like the sort of concept of being a detective, sort of like Nancy Drew, teenage detective. And what I liked about dermatology is that every day patients come in and they present you with clues. And the clues could be a rash on the abdomen or a brown bump on the nose. And those clues can lead you down the path towards diagnosing a medical illness, which could be limited to the skin or actually stem from an underlying systemic illness.
Where'd you go to school?
So I went to UCLA for undergrad, then I went to UC Irvine for medical school, and then I interned at UC Irvine, and finally I went to Florida for dermatology residency at the University of Miami.
I guess Arizona, California, and Florida would be good places to study dermatology.
Oh,
We have a lot of sun.
Tons of, lots of UV, high index
Minnesota
UV
might not be the right place to study dermatology, maybe.
No, maybe not if you're interested in skin cancer.
Right, right, which is one of your areas of specialty. You're kind of the gatekeeper. People would come to you first and say, Doctor, I have this, as you said, a rash or this mole or whatever it might be, and you'll look at it and you'll say, don't worry about it, it'll go away, or it's nothing important, or let me take it off, or let me take it off and take a look at it. And that's kind of, that's when the process of the detective process starts.
Exactly. So if something doesn't look right to us, we'll do a little biopsy, which is a process by which we numb the skin, remove a little piece of the skin, send it to the lab for them to look at it underneath a microscope. And once the diagnosis of skin cancer is made, depending on the size of the lesion, the type of lesion, the location, we may or may not refer them to Mohs.
Mohs. Now that's our topic today. M-O-H-S?
Yes.
Mohs surgery.
Correct.
We think of surgery as, you know, scalpel and the guy cuts away. What's Mohs?
Well, Mohs is a specialized skin surgery where you control how much tissue you take out by using a microscope to look at each slice of tissue removed. Basically, it was invented in the 1930s by a general surgeon named Frederick Mohs. Nowadays, dermatologists who are specially trained in that specialty perform the procedure. But the two main goals of Mohs is to, one, completely remove the skin tumor, but then two, to maximize the preservation of the surrounding healthy tissues, and that's those two goals are achieved by using the microscope.
Especially important if it's on your face or hands or something that shows a lot.
Especially. There are a lot of different indications for Mohs, but the two main indications are based on the physical qualities of the skin tumor and the behavioral qualities of the skin tumor.
We'll hear sometimes somebody say they've had a procedure and they say, and they got clean edges. That's what you're looking for, right? Is that last slice has got no cancer cells, right?
Exactly. When we saucerize or remove the tumor, they slice it horizontally, and they put each slice of tissue onto a microscope slide, and then we check the tissues on the slide underneath the microscope. We check to make sure that the lateral margins are clear of the tumor and the bottom margins are clear. If there's signs of residual skin cancer, then we'll go back specifically to that site and remove a little bit more tissue.
Right. Would it ever be followed up with things like radiation or chemotherapy?
That's an interesting question. Usually, Mohs surgery is a very effective way to remove skin cancer with a very high cure rate, especially for basal cell, has a 99% cure rate. Radiation treatment would be reserved for skin cancers that can't be treated surgically, either because the patient is their physical condition is debilitated, or the patient's particular preference is not to have surgery, or the skin cancer is in a location where it's very difficult to remove or too extensive.
What about lasers? We hear so much about lasers today. Can't you just go zap and take it away?
I'm sure that's in the future. In the lab, actually, there's a laser-specific way of selecting tissues, specific skin cells underneath the microscope to go and amplify the DNA, but that's not a common bedside practice at this moment.
All right, that's the future for the doctors that are now at UCI studying to be doctors and dermatologists.
And Kaiser.
And and going to Florida to learn all that stuff. Well, we hear a lot about skin cancer, and we all think we kind of know maybe what it was caused by, but from a professional standpoint, what are the causes of skin cancer?
Well, the two main factors for skin cancer formation is your background genetics and also environment. So unfortunately, at this point, we can't control our genetics or gene expression, but we can control our environment. And the main player in the environment is ultraviolet light. So that, in combination with your background, will give you an increased risk or give you your particular risk for developing skin cancer.
We all remember the Beach Boys song about the California girls, they all look so tan. And that's the look that a lot of people associate with California and Florida and Hawaii.
That's true.
There's risks involved with too much sun exposure.
That's correct. And the more UV exposure you don't just get your daily vitamin D, but you also increase your risk for basal cell carcinoma, squamous cell carcinoma, and melanoma, and other skin tumors.
You mentioned vitamin D. We're hearing a lot today that they're finding some folks, in fact, are having not enough vitamin D, probably because some people are being very enthusiastic about putting on the sunscreen. How much vitamin D do we need, and how do we get that safely?
Well, that's a very good question. It, in fact, is a controversial topic. But my recommendation is that wear sunblock once a day, at least before you go out the door. And usually that sunblock does get wiped off, sweated off during the day, and when you're driving home, you do get sun through the windows that can activate the vitamin D2 into the active vitamin D3 for your calcium absorption and metabolism. However, that said, everyone needs vitamin D. We don't need to bake, because the more you bake in the sun, the higher risk of skin cancer will be.
So if someone's going to go play 18 holes of golf, they want to put on sunscreen.
Oh, definitely.
And during that 18 holes, they'll probably enough of the sunscreen will go away. They'll get plenty of vitamin D.
Right, and they probably get too much vitamin D, which is why it's essential for you to reapply sunblock when you're outdoors every 2 hours. If you're perspiring excessively, you want to reapply earlier. If you're swimming, toweling off, you definitely want to reapply earlier.
Tanning products, one used to say tan don't burn. We've heard of people using coconut oil, baby oil. On the other side of that, we've seen the old California lifeguard shot with the red trunks, the straw hat, and the zinc oxide on the nose.
Very cute.
It's the look,
Yes.
So it says, I'm a lifeguard, maybe. What are these products? Are they good, bad? What should we be careful of out there?
Well, it's important to know that when you use a sunless tanner, basically it's a dye which adheres to the stratum corneum, which is the top layer of your skin. That just paints the skin. There's minimal SPF provided or sun protection provided by the sunless tanner. So if you're going to use a sunless tanner to look good, to have the Baywatch look, then you want to use sunblock on top of that.
All right, what about tanning booths?
Tanning booths, I think they're the axis of evil. They should be banned. And as you know, if you probably heard in the news, if you start using tanning booths under the age of 30, your risk of melanoma increases by 75%. So if your risk of developing melanoma is 1%, you have a 1.75% higher chance of getting melanoma. That's almost doubling your risk.
All right, good information. If you have questions about your skin or any other medical issue, contact the good folks over there at Kaiser Permanente. And Dr. Yang, we thank you for your time today.
Oh, thank you for having me, Rob.
Presuming by.
Thanks.
Good information about the sun, skin cancer, and Mohs surgery, one of the good techniques to help deal with those cancer conditions. We'll be coming right back with more right after this.